All right, welcome everybody back to Stuff It, a fantasy basketball podcast. Excited about today's episode. I've sort of teased this on Twitter a little bit. I think it's it's the first episode like this that I've seen or heard of in fantasy sports or fantasy basketball. Anyway, let's be honest. That's my focus. We're going to do an injury-focused show. So we're going to talk about some players that have suffered injuries recently. Now, this is a show I wasn't going to look at doing until next year, but we had a couple of injuries during the playoffs. We had a curious injury, I won't say mid to late season, which we'll cover as well. So let's bring him in. Jeff Stotts was recommended to me. Reach out to this guy. He knows what he's talking about. And obviously with what's behind you there, I hope you do know what you're talking about because it's not a normal background. How are things, Jeff?
Oh, we're doing well, enjoying these playoffs. I think unfortunately injuries have been kind of the headline for a lot of the bigger names. I think part of that is just because you've had so many big name players sustain injuries like Tatum, Damian Lillard at the beginning of the postseason, both unfortunately the same injury. And then we've kind of had this just reoccurring current, like you talked about, all season's kind of been an injury-plagued season. We've had a lot of big names go down, a lot of people going into the offseason with question marks, and then, you're starting to see some offseason surgeries already starting to stack up for people potentially coming back next year. So, I hate being on anything because, somebody got hurt, but, at least it gives me a place to share on some knowledge and hopefully educate on injuries and what to expect moving forward.
Yeah, and this is something that obviously if you play fantasy sports, injuries are a part of the landscape. You have to deal with them. You have to figure out how long is this player going to be out. We had some weird ones this year. We're not going to go all the way back, but yeah, we had some curious injuries. There always, to me, there seems to be, and again, this is probably just from a fantasy analyst perspective because we have to stay on top of all the injuries, but there seems to, every year there's a common or I guess one particular injury that, okay, we've had a lot of these injuries this year. A couple of years ago, it was thumb and hand injuries. We had quite a few of them. This year, we've had, I feel like, soft tissue. So groins, adductors, hamstrings, those sorts of things. And if we go all the way back to last season, Tyrese Halliburton suffered an injury like that, and then he rushed back. The question, I guess, that we get as fantasy analysts is how long is this player going to be out with a hamstring injury or something like that? And my, I guess, growing up, exposure to these injuries, playing sport and watching sport here in Australia, we have a lot of football codes, and a hamstring injury is a month minimum. If you do a hamstring, it's a month, maybe 6 weeks, which in our codes, that's 4 games or 6 games. In the NBA, that's 20 games, 15 games. So it seems to be a lot longer. It seems to be a lot more. So it just, I guess, if we just generally start with not necessarily a player, although, Anthony Davis had that adductor injury. But if we start with soft tissue injuries in general, because we hear grade 1, grade 2, grade 3, if we're speaking broadly, what does that mean? And what is the recovery? Because surgery is not usually associated with these injuries. I know a player can have surgery, but what does a recovery look like if we are here in grade 1, grade 2, grade 3?
So first off, soft tissue injuries were up this season. I track injuries across the board, and collectively outside of that COVID-riddled season as we came back out of the bubble, the games lost due to injury were the highest they've been. So significant, and the big spike was in our calf and our hamstring injuries, in those soft tissue injuries like you mentioned. So, it is a common occurrence. I think a lot of people are looking for the reason why. I have my theories. I think part of it is probably the increase of space of the court has led to our players needing to do more start stops. The pace, yes, is elevated, but it's not necessarily as drastic as some would suggest. But again, the floor at which these players are playing is significantly expanded. You're asking your power forwards, your centers to extend themselves all the way out to the 3-point line, where they didn't do that in years past. And that's just hard on the muscles. It's hard to do that over and over and over again, plus be fast and then make a sudden start stop that leaves the tissue vulnerable. So in a strain, which is a muscle injury, we classify based on the amount of damage accrued by the muscle involved. So if the muscle tearing is limited like a microfiber, so our muscles are made up like kind of like a wire, a bundle of rope, where every little fiber of that rope makes up the overall integrity of the rope itself. If those fibers are just stretched, maybe some micro tearing, we call that a mild or a grade 1 strain. For most mild injuries, you're looking at 7 to 10 days, maybe stretch it out to 14 days, 2 weeks, just to be certain that there is the healing has appropriately occurred. A grade 2, we also call a partial or an incomplete tear. That's where you actually have tearing of those individual fibers. So you get some, if their fibers are like this, you get maybe some tearing there. So now you can see how you've got some potential damage, and you've got to wait for those tissues to be laid back down, and that takes time. Those are that's where usually we say 4 to 6 weeks. But the problem, like you said, with those types of injuries are our healing process isn't really all that efficient. Our body just tries to go in and spackle the damage and take care of it. But you want to make sure that over time it's aligned in the appropriate way, that the scar tissue is as strong as possible. Because what happens is a player starts having scar tissue built up and they feel better because they're functionally not limited anymore, but that tissue is not as strong as it was. So they go back out there maybe a little prematurely, and that scar tissue tears, or they suffer a strain somewhere else along the kinetic chain, and it presses a reset button on the whole healing process. And that's the problem with a lot of our hamstring injuries, because it is a delicate balance of the healing process. Grades 3 and 4, anything higher than that, you're talking about a complete tear or a rupture. Depending on the muscle, we're talking about potentially surgical intervention to anchor that back down, like the Achilles, which now we're talking of recovery measured in months, not weeks. And that is usually dependent on the involved area as well as the treatment plans, which most often in certain areas require surgery.
So you touched on there, I guess, the cause for this increase in injuries, and I'm sure there are a number of factors. As someone who's watched a lot of basketball, played a lot of basketball, one of the big, I suppose, and sometimes frustrating from a viewer's perspective, changes in the game is the amount of stoppages for reviews, timeouts, media timeouts, all that sort of thing. To me, I mean, and I could be completely off base here, but do teams, and I'm not behind the doors of what teams do when they train, that sort of thing, but is there now a difference between the way teams train? So you go to a training session, a 2-hour session, fairly full on. A game can be so stop-start, play for 3 minutes, stop for 2 minutes, play for 8 minutes, stop for 6 minutes. Would that contribute at all, or is that something that teams factor in the way that they prepare for the games?
I think as far as specific like time stoppage, that's difficult to predict from a standpoint of it's there's no guarantee this game. I think smart teams are going to advise their guys to do certain things during those stoppages. Hey, get off your feet and sit down. Or hey, if you're warm, go hop. But if we know this is going to be a longer break, let's go get on the bike. Most teams have that like exercise bike to just stay warm on the side. So I think there are ways you can work around those start and stops. And sometimes that's just a nice break fatigue wise anyway. You rehydrate, kind of slow down a little bit. But I think the thing that people don't realize is how much players actually are doing things like active recovery or working out even on game day. If you have a guy that doesn't play, he might finish the game and then go back to the back and get a full workout session in. Or if a guy has minimal minutes, he might go back to the back and get a lifting session in, or in some cases maybe even playing some degree of basketball, with reps and things like that, just to continue to stay in shape and control the amount of load put on this body. Because what you can't do is have an end of the bench player that hasn't done any action in 2 weeks, and suddenly he's thrust into a high minutes load. That's a major peak in his workload, and it's those major peaks that we get potential increase in inherent injury risk. So most staffs do everything they can to monitor their overall participation for each of the individual players and adjust that based on need, whether it's an injury already occurs or hey, today the matchup's going to call for you to do this, or a suspension, or whatever the case may be, that may result in a change in minute distribution.
All right. So look, before we'll jump into a couple of specific players and specific injuries, but before we do, quick break. Bet Online is the world's most trusted betting platform and your number one source for all your betting action. Baseball is in full swing. NBA, NHL playoffs are going. Almost done in the NBA, only 4 teams left. BetOnline has more ways to stay in on the action with the latest odds, news, and scores, even live in-game betting while the games are being played. The largest selection of odds on everything MLB, NBA, NHL, UFC. BetOnline remains the best online source for your sports wagering info. And if you're not into the sports, go and head over to the BetOnline Casino Poker, all sorts of online games there, if that's your bag. Bet Online, the game starts here. All right, let's start. Now, this guy wasn't on our list originally, but then I thought of him when I woke up this morning. Victor Wembanyama, not an injury per se, but a medical issue, blood clots. Now, I mean, we could even throw Damian Lillard into this discussion because he also suffered some blood clots. But starting with Wemby, because we're already starting to look ahead to next year and talking about fantasy ranks and things like that. Where does Wemby rank? And you hear things, you read things, that he is sort of slated to be cleared to play in Eurobasket, which France are playing in August, I believe. But I guess just looking at a blood clot issue, because that is one thing that I know very little about. Sports injuries, yes, because I've suffered most of them, so you have some sort of an idea. But blood clotting. So how does something like this come about, and what's the treatment? Is it just waiting and like how was Damian Lillard cleared to return after whatever it was, a month or 3 weeks? It seemed quite quickly. Wemby much longer, and then if we go all the way back to someone like Chris Bosh, who had some blood clotting issues, I believe, and was forced into retirement. So they're 3 very, very different outcomes. What's sort of the discussion points around something like this?
So Lillard and Wembanyama both had DVTs, which are deep vein thrombosis. And all that means is a clot located in the vein. So our veins return blood back to our heart. And the big difference between those two gentlemen is Wemby's DVT was in his upper extremity, so in his arm, which was in his calf, I believe. And for the calf, those are pretty common occurrence. And from a standpoint of our blood is working against gravity to get back to our heart. And so our veins have little valves to help prevent flow from coming back, but our muscle tissue around it actually helps pump that blood back towards the heart. It's one reason why they tell you if you're on a long flight, make sure you're doing some calf raises to help circulate that blood. You see a lot post-surgery where people wear the compression socks around their calves, or even the machines that help squeeze the calf, and that's because they're being sedentary, and so we want to make sure that blood is being pumped back and the clots are not occurring. For Lillard, his DVT, all they did was blood thinners, it sounds like. So a little anticoagulating medication, blood thinning. And the big thing with him was not that they were worried about the DVT. It was if he gets another cut while on the court, or he suffers some kind of like an injury to his spleen or some other internal injury from a collision or whatnot, the likelihood of bleeding out is significantly higher because you're on that blood thinning medication. So a lot of times you take the medication till the clot clears, then you got to stay on it for a little bit longer. And then once you've been off of it for a certain amount of time, they clear you. Lillard's clot might have been very small. It cleared pretty quickly. They were able to wean him off the medication and feel comfortable with him playing. Wembanyama's is a little different because it is his shoulder. There have been some whispers that he might have had surgery. I've seen maybe somebody slip up. One of the French national coaches or something like that mentioned maybe coming back from surgery. Maybe they misspoke. But I've yet to see confirmation that he has in fact had surgery. But it's likely his DVT was a result of an impingement in his shoulder. And so doing a repetitive motion like basketball, especially someone like Wembanyama who has those ridiculously long arms, large wingspan, could leave him vulnerable to the impingement in the shoulder, which led to the DVT. Now, to address that, they have to go in surgically and address what causes that impingement. We saw this several years ago with Brandon Ingram. He had the one in the shoulder, and he had to have surgery as well. There have been no indications on either case if this is something genetic. That's where you worry. That's where I believe Bosch had some underlying issues that contributed to reoccurring blood clots. By all accounts, Lillard's and Wembanyama's situations are both isolated incidents. So the hope is with medication, the clots have cleared up. Now, especially in Wemby's case, they've addressed what was the potential root of the clot, and now he should be fine moving forward. We hear this more in baseball, thoracic outlet syndrome, and that's where the blood vessels and your nerves that run from your neck into your upper extremity get pinched somewhere in here. It can be beneath a rib, it can be beneath some of the muscles that run right here. And so if that was the cause for Wembanyama, they would address that surgically, opens up the channel for blood flow to go and the likelihood of this clot reoccurring, and then he should be fine moving forward. But I'll be keeping an eye on what he looks like moving forward for sure. And if we get some kind of confirmation that he has had surgery, I actually feel better about his long-term diagnosis because the root of the problem has been addressed.
Yeah. Okay. I guess, so let's stick with Damian Lillard because one of the injuries that we've seen, the major injuries, is Achilles tear. We saw one for Damian Lillard and then Jayson Tatum, a week ago, 2 weeks ago. I guess just quickly, I mean, we'll get into the injury itself, but the blood clot issue, the Achilles, is there a chance the two are related with Damian Lillard? To me, it's probably not the case, but I have heard, again, you read things, you see things, but is that something that's possible?
Maybe. I don't think they're directly connected. Indirectly, maybe you're talking about the time off resulted in, a potential spike with his return to play, that kind of thing. But I think it would be unwise to completely say no influence. But I also don't think it's necessarily like, okay, everybody that has a DVT needs to be worried about potentially rupturing their Achilles. I think the link there is probably very, very minimal. Lillard's situation is unique from a standpoint of he's one of the older guards to suffer this injury. We've seen it more in kind of a little bit younger. A guy like Durant was a little bit younger than this. Klay Thompson was a little bit younger when he tore his Achilles. Now Thompson's an outlier because he had that double whammy of the ACL and the Achilles. But it's going to be interesting to see. And the crazy thing is we had these two guys, superstar level talent, suffer the same injury within a relatively short span together, but they're different positions and different ages. And I think that's going to really affect their recovery. I think Tatum is more likely of the two to come back a little bit quicker because of his age. He doesn't have the workload that, even though Tatum's minutes were significantly high, doesn't have quite the load that Lillard had, and is at a different spot in his career with Lillard. And that's one of the things we've seen with some of these studies is the older you are, the harder it is to come back, especially from a high intense injury like this. The best comp for me, age-wise and part of career would be Chauncey Billups for Lillard, and Chauncey did not look good once he returned from his Achilles. So I think it's going to be very interesting to see when both these guys come back, because that could influence their overall productivity and how effective they are when they do return. Because these injuries happened in the postseason, it's going to be interesting to see where their teams stack up and if they're going to rush them back or if they're going to give them the full year off and say, hey, we're just going to count this as a full year. Because you look at one of the most successful recoveries from Achilles, and that's Durant. He was out 18 months, and that was part of it was by design. He had already said he had planned on sitting out the full year, but we also had the pandemic hit, and that extended how long he was off. He didn't go to the bubble. Then the season, obviously the next season was impacted. So his return to play date was significantly longer, and he looked sharp right out the gate. So I will be very interested to see how both Tatum and Lillard handle their respective recoveries.
Yeah, I think to most people, Achilles, ACL, these are sort of the serious but common injuries that we hear about. Recovery, 12 months, 10 to 12 months. So for someone like Tatum or Lillard, we're looking at a return, best case scenario, late in the regular season. But I mean, what are the Bucks going to look like in 12 months? Is Giannis going to be there? Are they going to be pushing for the playoffs? We don't know. So it could be a situation where Lillard just, sits out all of next season, and then he gets that additional 2-3 months before training camp. So it could end up being a 16-month absence for someone like Lillard, where the Celtics probably more of a chance that they're pushing for the playoffs. And as you said, Tatum is a little bit younger. So moving over to the ACL, Kyrie Irving tore his ACL prior to the playoffs, and obviously Dallas's trajectory changed a lot following the draft lottery last week. I don't know when it was. It wasn't that long ago. With Cooper Flagg likely coming in there, Anthony Davis healthy. The one spot they need filled is that point guard spot, and that's going to be Kyrie's role. And you mentioned the older the player, the harder it is to come back from these injuries. I'm familiar with ACL tears because I've torn both of mine, and I'm currently 3 months into the recovery on one of them. And look, my knee's feeling pretty good now. Obviously, I don't get the treatment and the sort of therapy and the rehab daily. It's up to me to just do it when I get up in the morning, or squeeze some in during the evening. So, and I'm also 46. I'm not 26 or 31. So my recovery is a little bit slower, but my surgeon in both of my recoveries was very adamant in sort of talking to me about the recovery of an ACL, in that it gets better quite quickly. So you think, oh, this is good, I'm feeling really good. But if you push it too hard, the recovery actually plateaus a bit, and then you're sort of like, I'm in that phase now of it got to a point where it was feeling pretty good. And now the improvements are so minute that on a daily basis, I don't notice anything. But if I think, what was I doing 2 weeks ago? I'm actually in a better spot now. So, and I have no envisage of, well, my wife won't let me come back to play basketball. So that is not my goal. And my goal is just to get back to playing golf. But for someone like a Kyrie, 10 months, 12 months, like, what are we looking at here? And again, ACLs are something I can talk about quite a bit. My first ACL tear, they took part of my hamstring in my left leg and sort of grafted that in that makes no sense to me, but I'm sure you can explain that a little bit. With my right knee, which I had done 3 months ago, I had a donor ACL. So they didn't touch my hamstring, which I'm very thankful for, because that was actually the harder recovery in my left one. It was recouping and getting that hamstring. And I still don't think it's back to what it was. This one, I haven't had to worry about that. It's purely the knee. But to me, having someone else's ACL inside me, that graft could take longer to take, I suppose. So when someone has an ACL injury, there are two options. Is there a third? And what is the recovery time? I don't know whether you know which option Kyrie would have had.
Yeah, I don't know if he's had an autograft or an allograft. So auto is from your body, allo is from someone else's body. There's also a couple new techniques, but they're not yet necessarily using them great on high-level athletes yet. So they're actually not utilizing some of the other different approaches yet. But the big thing is, what they do is they take a piece of the tendon and utilize that and reconstruct the ligament to do just that. You know, a lot of people think they just go back in and suture the two. That's not the case with the ACL. A lot of times it's literally just creating a new graft, creating a new ACL. You know, you already heard some optimism from people in Dallas's camp that January, February, maybe. The good news is it's isolated ACL, so we're not looking at additional meniscus damage here. We haven't heard anything with the PCL or the MCL. Sounds like it was pretty isolated to just the ACL, which is good. It allows you to begin your recovery process quicker. You're not, if you have meniscus damage, you have to potentially be off, no weight bearing for the initial 4 to 6 weeks, depending on the approach that's taken. If it's just an isolated, you can begin movement and doing those things that they want you to do a lot quicker. One of the things I do before I continue is Kyrie's mentality has just been top notch. And you talked about the grind of the recovery process. Mm-hmm. the mental aspect of it is a massive, massive part of recovery. And by all accounts, Kyrie is in a good place mentally. He is, he's openly talking about injuries. He's talking about how he understands what's going on. I'm sure he's talked to people. He does have a history of injuries as well, so he's familiar with what it takes in terms of the recovery process. And he's already got that mindset of this is not going to define me. And that is half the battle in a lot of ways, because again, you hit those plateaus and it gets frustrating and it's hard. And like you said, early on, you don't have to do work much and you seem to get a pretty big improvement. But again, once you hit those stop getting those big gains and it's incremental gains, those are when it becomes a grind. And and this is when it's most important for ligamentation to occur, for that ligament to be taking hold and beginning to take on those biomechanical properties of the original ACL. So we generally say, 10 to 12 months. We've seen it in other sports where it's been quicker, like an Adrian Peterson, but those guys are the exception, not the norm.
Mm-hmm.
And I bet Dallas slow plays this situation to make sure he's 100%, as close to 100%. I think All-Star break is probably a realistic goal from a standpoint of make sure he takes his time. It's obviously going to affect his fantasy value going in the draft next year, because you're not getting a full season. But the big thing with Kyrie is I am optimistic of what that's going to look like more so in the following season, because generally what we see productivity-wise is it's not that first year back, it's the following year. So, already for fantasy purposes, there's going to be a baked-in value because he's not going to be back. He's going to miss a significant portion of the season. But if you want to gamble with Kyrie, you're playing the long game. You're looking at potentially he's got more value in a dynasty league or things like that, where it's going to be playing not just for next season but the following season as well. And I think Dallas understands they've got, following the trade of Luka, their window is drastically changed to a 2 to 3 year window versus a 10-year window. But that's also rewritten now that they've got flags. So it's going to be an interesting offseason for them to see how they balance that, because if they can find somebody to be a serviceable stopgap, all that's going to do is buy Kyrie time to make sure he's close to 100%. The more successful Dallas is, I think the more conservative they're able to be with his recovery to ensure that he's 100% healthy when he gets back.
All right, so we'll finish off with just a couple of, I guess, compared to ACLs and Achilles, they're minor injuries. And we talked about hamstrings earlier, and one that I just quickly want to touch on was Aaron Gordon. So he suffered a hamstring injury in game 6, I think, game 6. And all indications were that this was a grade 2 and he wasn't going to play in game 7. And I was at work that day, so I was just assuming he wasn't playing. There was no way he could play. And then I checked the box scores and highlights, and he was out there playing. Is that like, I know in certain situations players play through injuries, and we'll get to Michael Porter Jr. in a minute. But is this a situation where this is a bit of negligence, or like can he further damage this injury to the point where I don't need surgery and now I do need surgery, and that's a longer recovery? Would this decision have been made sort of by him largely, or how involved would the medical team be in something like this?
I think it's a cohesive conversation that both are having. The good medical staffs have a good relationship with their parents, or with their patients and with their athletes, and they are able to have an open dialogue and present, this is what this means. These are the inherent risks that you're taking. These are the things we can do to potentially mitigate that risk, but there's still going to be a degree of risk. We always say, oh, well, if it's the playoffs, he would be playing. Well, that basically means your return to play guidelines have a degree of subjectivity to it. Like they're not a cookbook approach. It's not do this, and you're back. There is a layer of gray to it. And that's good, because it does leave the subjective component, feedback from the athlete, to be involved in that decision. Now, it's up to the medical staff to also say, hey, we can't let you out if we know it's going to be something detrimental to your health. And I think if that had been the case, he would not have played. I think they were able to get him to the point of, he was clearly hampered. If you watched, he didn't have that explosiveness. I think there was some hope that, hey, can we get to the conference finals and maybe sit you for a little while and see how we do against Minnesota without you and start
Yeah.
the recovery process, but it was do or die being a game 7.
Hmm.
Generally speaking, grade 2 hamstring strains are looking at 31 days missed. So he's, again, an outlier on that. But part of it is because it's going to limit productivity. And so I think in most normal circumstances, you're not going to put a guy back out there because he's not going to be effective. And it does increase your potential risk for an injury somewhere else. But you have to find that balance between all parties to decide if it's worth that gamble.
So we'll finish up with Michael Porter Jr., who another Denver player who suffered an injury. I'm pretty sure it was very early in the playoffs, like first game, second game. And so this was a shoulder injury, which was pretty obvious to everyone. If you were watching him play, it was heavily strapped. He had some weird kind of padding on there, which always looked like it was going to fall off. And he played through that injury for basically the entire playoffs and talked about the fact that he couldn't lift his arm beyond a certain point. If this was the regular season, he would have been missing significant time with this injury, and he was able to play through it. But so I guess this is just a general, what was the injury for him? And is this, I'm assuming, and I think they even mentioned this on the broadcast, that he had basically been assured that he could not damage it further by playing. And look, he had a couple of good games, but is this something that's going to linger into next season for, if we are talking about fantasy managers, or is this a surgical procedure, which he's probably already had, and recovery starts and he's fine by training camp?
So I actually can turn here. I got my little skeletal model here. So the shoulder is right here, and it's made up of a bunch of different joints. So you have the glenohumeral joint, which is your ball and socket joint. That's the one we all associate with the shoulder. It's how you can move your shoulder all the way around. Yeah. It's that ball and socket. We have the sternoclavicular joint, which is right here, right where the sternum and the clavicle come together. So right in your chest. This is actually kind of serves as a strut, and it's the only way your shoulder is truly attached to your bony skeleton. Mm-hmm. And then as you follow the collarbone over, you get to this joint right here. This is where the acromion of the shoulder blade, which is this little bump right here, and the collarbone, the clavicle come together to form the AC joint. And that's what there's ligaments here, and that's what Gordon sprained. He sprained the ligaments that stabilize this joint. So an AC sprain. You often heard this called a separated shoulder. Mm-hmm. I haven't heard specifically if he had a grade 1 or grade 2. The AC joint is actually unique. It's got its own types of injuries. It can be type 1, type 2, all the way up to total tears of the ligaments. If this bone comes up, it can disrupt the muscles that surround that area. Likely somewhere between the mild to moderate sprain. I haven't heard anything where it was a true tear or, those would be significantly more difficult to play through, even with KT tape and a brace on, would potentially be problematic. So I think what you're looking at is, a grade 1, grade 2 sprain of that AC joint. Now, fortunately, unless it's severe, surgery is not an option. Those ligaments will heal over time, which would be different than if it had been the glenohumeral, because that's where you have that cartilaginous labrum. And if the labrum tears, we've seen that with guys that have dislocated the shoulder, like Kevin Love, Jalen Brunson, Carmelo Anthony. Those guys have ultimately undergone surgery to have the labrum repaired, which does help restabilize that joint, which is important because as mobile as the joint is, the cost of that mobility is stability. And so if you're chronically unstable in that joint, it can continue to come out of place, sublux or dislocate, and that can be problematic, obviously. So you want to make sure it's as stable as possible. With the AC joint, time is one of the best medicines for it. Obviously he'll be receiving treatment, but over time, those ligaments can heal, especially if he hasn't had any tearing of the surrounding musculature or any true ligament ruptures.
Okay, good to know. Good to know for fantasy, because he is no stranger to injury. As we know, he's had multiple back surgeries, I believe, and so that's good to know. So, look, I think we've covered everything, which is, there's a lot given it's the off season, and moving into next season, we'll try to do this. It won't be weekly, but just whenever you have time, really, and talk about what's going on in the league. But for fantasy basketball people, they may not know where your stuff is. Where can they find you? What do you do? I suppose if that's probably a question that people will have. So where can they find you?
So my work is at In Street Clothes. Like when a player is hurt, he's in Street Clothes. You can find me on X and on Blue Sky and any of the social media platforms. In Street Clothes is where you can find me. I write regularly for RotoWire, covering injuries for baseball and football, occasionally for hockey or basketball. And then I have my own site where I post stuff as well, and that's instreetclothes.com.
All right, awesome. So, yes, we will have Jeff back on, probably not for a couple of months now. Not much is going to happen between now and August, September. Fingers crossed. We've still got 4 teams playing, and we could get something, but let's hope we don't. But that will do for today's show. I'm Adam King. He is Jeff Stotts. This has been the Fantasy Basketball Podcast. Stuff it. We are done.